All right, so today we're breaking down the differences between CR and DR. That's computed radiography versus digital radiography. From invisible to visible, digital radiography explained. So now under DR, which is digital radiography, we have two branches as well, indirect versus direct. But we're going to go ahead and start with CR because that's where the digital world really began. Okay, so CR uses a special imaging plate called a PSP plate. That's a photostimulable phosphor plate. It's stored inside a cassette, and when x-rays hit that plate, a latent or invisible image is formed. Now this plate has multiple layers, and each one has its own job. Let's break those layers down one by one. Alright, so first up we got the protective layer. This one's simple. It protects the plate from physical damage. That's all you need to know about it. So next we're going to go into the phosphor layer. This layer is also called the active layer because it's where the image is actually captured after X-ray exposure. It's made of a compound called barium fluorohalide, but what really makes it special is that it's doped with europium. That's a rare earth element. So what does europium do? It creates traps, energy traps to be specific. When X-rays hit the plate, they knock electrons loose from the barium fluorohalide atoms. Instead of floating away, these electrons get trapped by the europium. This is what holds the latent image, the image that we can't see yet. Remember that. So no europium, no traps. There's no traps, there's no images. And it traps electrons in what's called a conduction band. Later, when we scan the plate with a red laser, those trapped electrons get released and they give off a blue light, and that light becomes the visible image once it's processed by the detector. Third, we have the conductor layer. Its job? To reduce static and electrical noise. Think of it as shock protection. Now we have the support layer. This gives the plate its strength and it keeps it from bending or breaking. Basically, it's like the backbone of the plate. Then there's the light shield layer, also called the reflective layer. It keeps light moving in the right direction during scanning so your image doesn't get blurry or weak. And finally, we have the backing layer. It's what holds the barcode. That barcode links the image to the patient's information. Alright, so now we've got the latent image stuck in the phosphor layer. Now let's talk about what happens inside the CR plate reader, how the image becomes visible. First, the cassette opens and the PSP plate is pulled into the reader. Then comes the laser scan. A red laser, usually made from ruby or garnet crystals, scans across the plate. This is called the fast scan. It quickly moves across the plate in rows, kind of like reading a book line by line. While that's happening, the plate slowly moves forward through the machine. That's a slow scan. It feeds the plate along a belt system row by row. When the laser hits the trapped electrons from the latent image, it kicks them back down to their normal state. As they return, they release energy in the form of blue light, because energy cannot be destroyed nor created. That blue light is called photostimulable luminescence, or PSL. Now, we need to collect that light and turn it into something the computer understands. So, the PSL is picked up by the fiber optics and they are sent to the photodetector. That photodetector might be one of three things: a photomultiplier tube, or PMT, which multiplies the light signal into a stronger electrical signal, a photodiode, which converts light into an electrical signal directly, or a CCD, or charged coupled device, that organizes and transfers the light into readable pixel data. We'll talk more on the CCD when we get to not direct, digital radiography. All of these convert light into electrical energy, but that's still not digital yet. Before the computer can process the image, the signal has to pass through an ADC, a analog to digital converter, which turns the analog electrical signal into binary code, which is ones and zeros, something the computer can read. This is the digital data that forms the image on the computer screen. But here's the thing, not all of the signal makes it. Some signal is lost during this process, and that's what we call noise in the image. After that scan is done, the plate still holds a little leftover data, so the machine uses a bright light to clear the plate. Now it's completely reset and ready to be used for the next patient. Now we're going to talk about direct digital radiography, also known as direct DR. This system skips the whole laser and PSP plate process we saw in CR. Instead, the X-rays are directly turned into electrical signals. No light involved. Here's how it works. When the X-ray beam exits the patient, it hits a flat panel detector inside the bucky. The detector contains a special photoconductive material called amorphous selenium. We call it A-SE for short. And remember, this detector uses a photoconductive material. Now, selenium doesn't glow like a phosphor. Instead, it's a photoconductor. That means when X-rays hit it, it doesn't emit light. It releases electrons directly. So, X-rays come in and electrons come out, all in one step. Those electrons now need to be collected and sent to the computer. That's where the TFT array comes in, the thin film transistor. Think of the TFT as a grid made up of millions of square pixel elements. Each square, called a DEL or detector element, collects the electrical charge from a small part of the image. The larger the DELs, the more signal they can catch, but if they're too big, it can reduce spatial resolution. The percentage of the detector that's actually capturing the image data is called the fill factor, and the higher the fill factor, the better the image quality. Once the charge from each DEL is collected, it's sent to an ADC, the analog to digital converter, as we talked about. This ADC converts the electrical charge into digital signals, which is ones and zeros, the binary code, for the computer to build the image. There's no intermediate step, no light emission, no photodetector, just straight from X-rays to electrons to the digital image. This makes direct DR extremely efficient. It's commonly used in specialties like mammography, where fine detail and low noise are critical. Alright, now let's look at indirect digital radiography, or indirect DR. Unlike direct DR, where X-rays go straight to electrons, indirect DR as a middleman, light. Here's a step-by-step. First, X-rays exit the patient, and they hit a special layer inside the detector called a scintillator. A scintillator's job is to convert X-rays into visible light. There are two main types: cesium iodide, which is structured like tiny crystals lined up in columns. This limits light spread and gives us a sharper image. Then we have gadolinium oxysulfide, which is turbid, meaning it's more random and is less organized. This scatters more light, which can reduce sharpness a little. Once X-rays turns into light, the light needs to be converted into an electrical signal, and that's the next step. The light gets picked up by a photodetector. There are two common types used. The first one is amorphous silicone, denoted as A-SI. Note that the other photoconductor was amorphous selenium, which is A-SE. This is the most common. It absorbs light and it turns into electrons. Another device or photodetector that you can use is a CCD, or a charged coupled device. This one also collects the light and it organizes it into an image, similar to how digital cameras work. After that, just like in direct DR, the electrons go to the ADC, the analog to digital converter, which turns the signal into digital code for the computer. Once it hits the computer, the digital image is processed and displayed. So remember, indirect DR equals X-rays to light, light to electrons, electrons to a digital signal. The scintillator goes to the photodetector, basically, and then the photodetector goes to the ADC. This is the most common system that's used in general radiography today because it offers good image quality with efficient workflow. The key trade-off is that light spread can reduce sharpness, especially in systems with turbid scintillators like the GAD-OX. But paired with cesium iodide, indirect DR can produce excellent images with lower patient dose. And that wraps up the breakdown of CR versus DR, plus the differences between direct and indirect DR. So let's recap real quick. CR uses a PSP plate and a reader. It takes a little more time, but it's flexible and still widely used. Direct DR goes from X-rays straight to electrons. It's fast, accurate, and it's sharp. Indirect DR adds a light step in between, using a scintillator and a photodetector before digitizing the image. Each system has its strength, and as a rad tech, understanding how they work helps you troubleshoot, optimize image quality, and keep patients safe. If this helped break things down for you, don't forget to follow for more radiology breakdowns, study tips, and fast facts that actually make sense. Catch you in the next one, and remember, we don't just take pictures, we tell the story behind the shadow.